I wanted to share a little bit about trauma-informed design with you. And I'm really speaking about design as it relates to websites and apps because that's my expertise. That's what I've been doing. I'm a UX designer and I've been doing UX design for 10 something years now. And I've been exploring this idea of trauma-informed design for, since about 2015 is when I first learned about it. And I just wanted to share what I have learned, what's been helpful to me. And this is just my perspective and my experience. There's various ones out there, and I encourage you to seek them out as well. But this is what I've learned, and I'm hoping that it will be helpful to you. So I also wanted to say that talking about trauma can bring up our own stuff sometimes. So I want you to be aware of that because that certainly happened to me. And take care of yourself, while you're watching this. And certainly if you need to talk to somebody afterwards, I encourage you to seek, a friend out or a therapist, or you're free to reach out to me if you just want to touch base and talk about any of the ideas we've discussed in this presentation. I first learned about trauma-informed design on this playground. This is in Durham, North Carolina in the United States where I live. And this is the playground where my daughter, she went to preschool and she spent a lot of time here. And she got to play with this other wonderful little girl. And her mom was there too, of course. And so I got to know this other mom whose name is Elizabeth Johnson. And she's a wonderful, I call her an educator really, in Durham, North Carolina. And she had been, especially at that time, doing a lot of education on helping nurses and doctors and other types of clinicians be more trauma-informed in their practices. And she kept using this word trauma-informed when she discussed what she did. And like a good UXer, I asked her, what she meant by that, because that's what we do. We ask questions when we're not sure. I said, what do you keep saying this word trauma-informed? What does that mean? And she explained really by giving me examples. For example, she talked about the police officer who might come up on a crime scene and maybe there are a few kids who are nearby and he or she would, maybe get down on the floor to talk with them or, at least kneel down so they were at the same eye level. So it wasn't kind of a conversation from a commanding authority down at a small child. Other times, she talked about a nurse could be trauma-informed if the nurse was asking questions at a medical appointment about past sexual history or abuse or anything like that, that nurse would be explaining why she was asking those things and would also be informing the interviewee as to whether the patient, whether that was going into the medical records or not. That would be trauma-informed. So she gave me these interesting examples. And I thought, wow, this seems really important. This is really interesting to me. So it really made me think about this book that I love, and this is by Ginny Riddish. Ginny is a contemporary of Steve Krug. If you've ever read Don't Make Me Think, it's a great book, and this is another great book that kind of came out around the same time frame in general, and I really like it. And one of the things that Ginny Riddish talks about in this book is that a good website is like a good conversation, and so I always have that in my mind that a website is somebody initiating a conversation with you, and what are you going to say with your website to them? And as I was listening to my friend Elizabeth talk about being trauma-informed and, how people were talking to other folks, I thought, gosh, well, it seems that websites also should be trauma-informed, and we should be making sure that people are having a good conversation, a good experience when they're coming to websites. So I started to learn more about trauma in general. I ended up on a project where I helped the North Carolina Coalition Against Domestic Violence help make their website more trauma-informed. And it's been quite an adventure. So I started by learning more about trauma. And so if that's kind of where you are, if this word trauma-informed is new to you, just start by learning a little bit more about trauma. And I'll just give you some highlights here. And there's certainly going to be more resources at the end. Trauma, this definition that I'm using is it's an emotional response to a terrible event. And this is from the APA. There are different definitions of trauma, so there's not just one agreed upon definition. Some tend to focus more on the event itself, like an event being traumatic, and there are probably events we could definitely agree seem to be traumatic. But it's interesting because this is really focusing on the reaction people have to whatever kind of terrible events occur. So here's the tricky thing about trauma, and I think this is why sometimes people don't understand it well or don't understand other people very well, is that trauma kind of can show up at different times with different people. So in 2014, it was Christmas Day, and we were waiting for grandparents to come. And on the screen, you can see that's my husband. That middle picture is me with brown hair, and that was my daughter back then. She's older now. And we were waiting for our grandparents, and we decided to take a walk on Christmas Day. It's probably around like 11 or 12. We decided to just walk down the street, and I think my daughter just didn't want to go because she was lagging behind by about 20 or 30 feet. And we were walking our dog, and we hadn't gotten very far at all, just a few houses down, and all of a sudden we saw this really big dog like jump its fence. And it was big and brown and barking, and it was scary. But it paused for a moment. We thought, oh, maybe it'll be friendly. And nope, that was not what happened. There was dog attack, and I want to let you know everybody is fine. But, it did mean like that, the dog got attacked. My husband ended up, having to go to the hospital too. And, there was blood, there was screaming. It was not good. It was bad enough that the insurance company was trying to just give us money to not sue. So that was a really strange thing. We didn't expect to happen on Christmas Day. And you would think that maybe from that experience, my daughter Parker would be like petrified of dogs from now on. And you'd be like, well, that is understandable and that sort of thing. But that isn't actually what happened. She seemed to have processed the event with grandparents who were there later in the day. She talked about it with different people in the family. And she's fine around dogs today. I think I think about this probably more every Christmas Day. I think about it. So this is just like one event that happened that we all kind of had different reactions to. My husband, honestly, I think has forgotten about it. and he was kind of like the main person who was able to get the dog by its collar and get it back into its yard and kind of like handle the situation. But it was a scary day. And that is one of the weird things about trauma, is that we could all have the same event happen. We could all have different reactions to it. And some people may be affected for a very long time to a traumatic event, and other people just not so much. It may just be like alone a terrible event that happened, but that just becomes a bad memory and not something that triggers what's often called like a trauma response. And whether somebody has a trauma response or not, can vary on so many different factors. I mean, I was reading research recently and there were 8 different factors, but there's probably tons more too. So we can't really predict like who's going to have a trauma response, who's not necessarily. But even something small can re-trigger somebody to kind of think about the trauma they experienced or start to go into thinking that is like negative and not helpful. So when we talk about trauma, there's kind of no way to talk about it without talking about these things called ACEs, which are adverse childhood experiences. And this is from the CDC. Thank you to the Robert Wood Johnson Foundation, which does a lot of good work and put together this graphic here. And these are some of the various experiences that people may have in childhood that can affect them in the future and can have serious long-term effects. And as you look at some of these, you might think, gosh, I've had some of those. And we do know that, something like, 70% of adults in the United States will experience some kind of trauma in their life. And that's, I think, research was mostly done with a mostly white population. So it's even more in minority populations. For example, people may experience multiple kinds of trauma. And if these happen, especially in childhood with where our brains are developing, that can be really problematic. So over time, the community level ACEs have come up. So we've realized that, in those lists I just showed you of the ACEs, that we weren't covering some other things that are a really big deal, right? So if you feel these things like discrimination, you're bullied, you witness violence, that things that are happening in your community, that can also have a significant effect on, your well-being. And the reason we care about these sorts of things is if you look at this pyramid, you can kind of see how the conditions that we experience as children, the social conditions, as well as whatever's happening in our own household, can start to really affect us early. And it affects us early, and it can continue, and it can even cause early death. So that is a problem. And that is something that, public health officials, we all need to try to work towards making sure that, it's a safe place for everybody to live and they're not experiencing this kind of trauma in their, whether it's in a neighborhood or a household. And as designers, this is the area that really jumps out to me as the area we can focus on, right? So we know that, somebody who's experienced trauma could have long-term effects, long-term cognitive effects of that trauma. And that might affect how they come to our website. Steve Krug has a great part in his book, Don't Make Me Think, about how people come to your site with some kind of reservoir of goodwill. And it's going to be really dependent on what just happened. And if what just happened was, a bad experience at another site, then that's going to affect their experience on your site. And it's just going to also affect not just their goodwill, but like kind of the state of mind they're in, how they're doing, what kind of capacity they have. We know that trauma has long-term effects, depression, insomnia, all kinds of things that relate to cognition and that sort of thing. And that can affect, whether somebody's able to navigate a website really well, or can get overwhelmed easily, that sort of thing. And it's interesting that it's not just happening, the year after a trauma occurred. We also know there's things like complex trauma, right? Where it's not just like one big event, but it's a series of events over time. So, trauma is something we need to all be aware of. And we can see that the hallmark symptoms of PTSD have to do with memory, attention, planning, and problem solving. And please know that somebody doesn't have to have PTSD necessarily or be diagnosed like that in order to have some of these issues, right? It's a spectrum. So there's a lot of us who may be affected by these, long-term effects of psychological trauma. So to be trauma-informed, or at least begin to be trauma-informed, I think we're all just trying to get there. It's just this recognizing that people can have different types of trauma in their life. So it could be the kind of interpersonal violence or, the kinds that we talked about in the ACEs, or, people have other kinds of trauma when a big hurricane hits the United States. We tend to have huge hurricanes and they are devastating, and that can have a huge effect on somebody's life, right? Or there's just a lot of terrible events. I'm sure you can think of many of them. So trauma-informed is also about being careful in our interactions, because we don't want to re-traumatize people accidentally as we are conducting research or testing out an app or something like that. Even if we are well-intentioned, we can still cause problems. So it's being sensitive to this. We would call it being, survivor-sensitive, trauma-informed in the way we go about our design. The great thing is that SAMHSA, which is part of the United States government, the Substance Abuse and Mental Health Services Administration, SAMHSA, they have these principles that underlie trauma-informed care. And these are great because these are things we can think about. How do these principles apply to design? Here we go. And there's 4 of the 6 that are there that I think already we do think about a lot in user experience design. We are often really trying to think about being trustworthy with websites and apps, and hopefully we're giving people choices. We have a user experience principle about user control and freedom. That is very much in line with trauma-informed care. And even ones like peer support, collaboration, and mutuality, those are things that we need to kind of keep in mind and think about. And I think when we do something like participatory design, we are thinking about collaboration, mutuality, which is great. So I think the 1, 2, 5, and 6 are ones that we kind of cover pretty well in user experience, and we can work more on 3 and 4. And of course, we can also be really careful about whenever we're conducting any kind of interview, making sure that it is trauma-informed, people are having choices and feeling safe, and really trying to give people what they need in order to not be re-traumatized in any way or triggered. You may think, well, I don't work with a population that, has a lot of trauma. I'm not a social worker. I'm not blah, blah, blah. But, I worked at a sports startup and I interviewed elite athletes. And I can't tell you the number of times that sexual assault would come up in our conversations, or other kinds of traumatic experiences with coaches, or just sudden changes and that sort of thing. People have a lot of things go on in their lives, even if, an elite athlete is somebody we might look at and think, oh, they have it all. But they may have struggled with, eating disorder or, things that happen in their life. And when we talk about their life story, they often go, wow, that was really cathartic. And I think, okay, good, because I didn't want them to feel like on the spot, or that they, soliciting stuff from them that they didn't feel comfortable sharing or anything like that. So even, all of us have trauma in some form. Not everybody is going to have a trauma response by any means, but we just need to be really mindful of how we are going about doing our design work. So I have a few takeaways for you. If you don't really remember anything else, I would really think a lot about cognitive load. And the great thing is that when you're working in UX design, you want to be reducing the cognitive load and making things so easy for people anyway. And that is only going to help anybody who has dealt with trauma in the past. I once interviewed a guy who was in charge of like 4 different e-commerce websites. He was really funny, and he just would say like, I just want people to like shake their butt and like buy a product, you know? He just was like wanted it to be frictionless, this easy experience, like as easy as you like, you know, accidentally pocket dial somebody. It was just that simple to buy a product. And we want it to be that simple for somebody who wants to get help, like reducing barriers as much as possible. So it's like, you know, keeping forms short, right? Only asking what's absolutely necessary, that sort of thing are things to think about. Don't give somebody like 25 choices on a homepage, which I still see sometimes, you know, give them a few. Guide your, you know, website visitors. The other thing I want you to think about is mobile. So mobile is really important because not everybody has access to a computer, especially when we're talking about, you know, lower income folks. The mobile phone they have may be the way they access the internet solely. And so we need to make sure our websites that are serving the general public are really working well on mobile, and somebody can, you know, do something, any kind of task there that they could, you know, do on somebody else could do on desktop. Mobile is also really important if you ever do design for anybody who's in some kind of, you know, crisis situation where they maybe don't have a lot of privacy, and you know, maybe the only time they could maybe look up information to get help is, you know, if they have their phone in their bathroom by themselves and they've got, you know, 90 seconds to themselves to like look up some phone numbers or that sort of thing. Well then, gosh, I hope your phone number is like one click to call and they could at least, you know, maybe make contact, or at least you know, kind of quickly get from your website, you know, what they could do, like what would the next step be, that sort of thing. So definitely keep mobile in mind as something we want to continue to work on, being more and more mobile friendly, because that will be more trauma informed too. And the last thing I just wanted to bring up is that, you know, if you're watching this video, then I assume you have some kind of interest in being more trauma informed. And maybe you're on a team of 6 people. You know, I have like these 6 little figures on my screen, and if there's just like one person who's paying more attention to being more trauma informed, you're probably going to be asking better questions and just thinking more holistically about the experience you're providing people. And when you start asking questions and using the word trauma informed, and helping other people understand what they are, you're going to start to really help your whole team just think a little bit more carefully about how we are working with our research participants, how we are building our websites and apps, and that sort of thing. So I encourage you to keep learning. We have a trauma-informed design monthly call. Just email me if you'd like to be added to that Google group list, and then you'll get that information. I also keep a list of resources on my Bird Call blog, and I will make sure to keep that updated with more as I find them, because there's new information coming out all the time. This has really exploded in the last few years in the sense of everybody seems to be talking in healthcare certainly, and in other areas as well, about how can we make things more trauma informed. So I hope that you will join me on this journey so we can make sure we are being trauma informed designers and really helping all kinds of people in the world.